All right, so I think I will get started. So again, for those of you who don't know me, my name is Noah Alexander. I'm an emergency physician. I work at Vancouver General Hospital, and I'm also starting to work on Vancouver Island, which is where I am today. So thank you guys very much for joining us for this digital health literacy talk. I'm also going to quickly introduce some of the iCON team that are here to help facilitate the talk, and will also be helping facilitate some questions that we'll take at the end. So first, you guys can maybe just wave. Alex Fung is with iCON. He's there. And then Anne-Marie is also there. Britta is there on top of the world. And then myself with iCON. So today's presentation is going to be about health apps. So apps that you can download on your phone or your tablet. And this presentation eventually can be used by community trainers if needed. But today we're just going to talk about it in more general terms. I'm going to guide you through the presentation and hopefully you pick up a few things. The purpose of this is not to give you an extensive overview of all the great apps that are available that can help you manage your health. The point today is really to try to motivate you to download some apps to try and mess around with them. Because at the end of the day, each app is very individual, and what's going to work for you is not going to work for somebody else. So the idea here is to motivate you to learn how to use these and also try to reduce some of the barriers that you may or may not have towards downloading apps. And if you're really savvy with downloading apps and using them and experimenting with them, that's great. Then my hope is that eventually this can be used within your community to help lower those barriers as well. So as I had briefly mentioned before, we are going to save questions to the end just to keep the flow going. If you have any questions, please type them into the chat and we'll get to them either at the end or partway through the presentation. If we get a buildup of questions, then one of the iCON team members will alert me and I'll answer them then. One thing that I would encourage you to do during this presentation, actually, if everybody can just do this now, make sure that you've got either a notepad or even notes on your phone or something like that, where you can jot down a couple of these apps that sound like they might be interesting for you. And that's what I would also encourage you, if you ever give this presentation again, to encourage your audience, because we've definitely shown that if you write it down and you download it immediately after the presentation, you're more likely to start using it, start experimenting. Okay, without further ado, let's see if there we go. Okay, so first off, I'm just gonna minimize something here 1 second. So what is an app? An app is a short form word for a software application. So that can be anything, right? Like it can be for health apps like we're going to talk about today, or it can be for Google Maps. It's all just applications. So you can download apps on your computer, your tablet, and your smartphone. There are millions of these things out there, and they can, any interest that you might have, there's probably an app for that. That's where I think it's the Apple saying there's an app for that. You can download them on two platforms, either the Apple Store if you're an Apple user, or on the Google Play Store if you use Android. So the question is, many people use apps, but how can we use apps to support our health? So what can they do for us? So, excuse me. Apps can be used to keep track of signs and symptoms that you may be developing. Some people find this helpful to then show their physician they've been feeling this type of dizziness, or they've noticed this nauseous feeling whenever they wake up. And you can track the way that you're feeling so that you can quickly relay all that information to your care provider. You can use it to track medications. This is particularly useful because many of us are on lots, or especially older adults, are on lots of medications. So tracking your medications is very useful. You can use it to set goals for your health, whether it's nutrition, weight loss, exercise, anything. And you can track progress on your goals. Whatever gets measured can get changed. But if you're not measuring something, it's likely not going to get changed. So this is a great way to keep track of everything on something that we often all carry with us. You can also use these apps that we'll talk about to find healthcare resources near you. So, big question. How do you find an app that suits you? So, the idea is that any app is going to have lots of little differences. There's many apps that'll do the same kind of idea, but there's slight variations within them. And you may need to try a few to find the right one. It's like trying on a jacket. You got to try on a few before you find the one that fits. Or it's like cooking. You got to experiment for a while until you find a few meals that you like. The most important thing to keep in mind is your goal and what you are trying to accomplish with using the app. And if it doesn't work, delete it. There's no reason to keep a bunch of apps on your phone, especially if you don't use them. It's best to keep only the apps that you're going to use on a regular basis and encourage anybody you work with to just keep those ones as well. You can always try them for a week and then delete them. There's no commitment, there's no contracts, unless, of course, they're paid apps, in which case you just want to make sure that you try out the app before you pay for it. Paid apps can be very much worth the money. Apps cost a small fortune to develop, and they also cost a lot to run. And so sometimes they ask the users to pay for that. And of course, they're also for profit. There's nothing wrong with paying for an app. It doesn't mean that it's a bad app. You just want to make sure that you're getting the value out of it that you need. So next up is just a quick disclaimer before we get into a lot of the apps. So we don't have any financial association as iCON. I don't personally have any association with any of these apps. And if this presentation is ever given again in a different context, it's important to ensure that this disclaimer is also given as well. So we don't have any conflicts of interest to declare here. So this is the broad overview of the apps and their categories that we'll be talking about. Can you guys see my pointer or no? Give me a thumbs up if you can see the pointer. Anne-Marie, I can see you. Yeah, okay. All right, so we're going to talk first about overall health. These are just general apps. We're going to talk about health services apps, a little bit of COVID-19, though that's not the focus of this, a bit on first aid, then nutrition, which is one of the key things that apps can really help with, as well as sleep and exercise. And then finally, we'll finish on mindfulness, which not everybody knows a lot about, but it's certainly getting more and more evidence. There's more and more evidence in the medical literature to support the health benefits of a regular mindfulness practice. So first up, we're going to talk about apps to do with overall health. So these are general apps that can be used for lots of different things. So the three apps that we'll talk about are Apple Health for Mac users and people that use iPhones, Samsung Health for those of us that use Android, that's what I've got, and then the Medisafe app, which is used for tracking medications. So first up, we'll talk a little bit about the Apple Health app. It's for iPhone users. It's almost, as far as I don't have an iPhone, but they're usually preloaded with this, and I think you can't delete it, but I'm not sure about that. So the Apple Health app, the key features are, one of the things that it does is a step count. So it'll count how much you're walking based on a mechanism that when you keep it in your pocket, it essentially clicks over. Same thing as a step counter, and it'll count these. It'll also even track how you are doing compared to before, or you can set a goal, and when you reach the goal, it'll alert you. You can also track your sleep, and that'll all sync to the Apple Watch if you've got one of those. And finally, you can track nearly everything that you might want to, including other more custom data. So that's Apple Health, really useful general health tracking. It can also be used to track specific medical issues. So past medical histories, say you've got diabetes, you've got high blood pressure, all that type of thing. So, and all lab results as well, immunizations, what meds you're on. And this is a really neat feature, is the medical ID. As an emergency doctor, I often see people that aren't able to tell us or tell me who they are. And we could use this medical ID if they've got an Apple iPhone to figure out who they are and look up their medical records. You can also, of course, use a patient's ID or a wallet if you keep that on you. But because more and more people are having their entire wallet in their lives just carried around in their phone, this can be really useful. And you don't need to actually have the passcode in order to unlock it. Paramedic or often a social worker is the one who helps us figure out who the patient is, and they can unlock it and access this information without knowing your passcode. Next up is Samsung Health. So this is very similar to the Apple version. It tracks general healthcare data, step counts. It's just for people that have either left Apple or never bought Apple. So it can track step counts, as I mentioned. It'll track your running time, food that you're eating, the amount of calories you're taking in, your weight, your heart rate, if you've got a watch, like a Samsung watch. Similar to the Apple program, it'll track a lot of general data. This app is really interesting. So as you may or may not know, medication errors are one of the major causes of morbidity among patients, particularly older patients. It becomes quite confusing as to when to take your meds, what you may have taken or not taken. There's lots of different sort of functional things that people will use, like the little pill boxes and that type of thing. But this is just another safeguard to reduce the number of medication errors. And it also comes with some additional features that I think are really useful. So the Medisafe app will allow you to track when you're supposed to take the medications. Some of the medications, they'll even show you a little picture so that you know which pill it is. And it'll remind you when to take them. It's also available in many different languages. A lot of these apps we'll talk about today are available in different languages. We do have lists of the different languages. I'm not able to remember every list for every app. So again, this is one of those situations where you'll need to experiment and see which apps have your language. Many of them are in simplified Chinese and traditional Chinese. Hindi and Punjabi seems to be, on average, a little bit more rare. But check out the different apps and find the one that has your language. Finally, Medisafe can also be used to share that information if you have a care provider. If a child or somebody else takes care of your medications, you can share all of that info so that they know that you've taken your meds and they don't have to worry. So we're going to move on to health services, this category. So the BC Health Services Locator is a really useful app to help you find walk-in clinics, hospitals, emergency rooms, immunization locations, which are going to become more and more popular and important as we roll out the COVID immunization. It'll also help you find pharmacies, labs, and it has a few other features that go beyond just Google. Again, Google Maps is great for this too. You can find a lot of stuff on there, but this app has a few other features that are pretty cool. So it'll provide you with the latest health alerts, and you can also call 811 right from it. Most people know 811, it's essentially access to nurses, and you can also access physicians through 811 to ask your questions and also determine if you need to go to the emergency room. This app will also help you determine that. And so again, just as a reminder, if any of these apps sort of spark something in you and you think, oh, that sounds like it might be useful, write it down, download it after this presentation, play around with it, and see if it's what you want it to be. So we're going to move on to the COVID-19 apps. We're only going to talk about one. Many of you have probably heard about the COVID-19 alert app that Canada has rolled out, but at the time that we made this, it wasn't available in BC. Hopefully it will at some point, but right now that's not. So what we will talk about is the BC specific support app. And so this will primarily be used to keep you up to date on government data about COVID, and it's a reliable resource. There's a lot of especially with the news right now, there's a lot of catastrophization of COVID, and there's a lot of bad news all the time coming out. And I think it's important for all of our mental health to make sure that we are limiting how much data we're taking in, and that we're getting any data from reliable resources. And this is one of those reliable resources. It'll also tell you when you need to go get tested, how you need to quarantine, that type of stuff if you've traveled, etc. The next category is our first aid. So apps that can help you determine if you need to go to the emergency room, if you're stuck somewhere at a cabin or out of the city and can't access, an emergency provider or your family physician, how to provide basic first aid. And the best app that I found for this was from the Canadian Red Cross. Like any of the online resources, you want to make sure that all of these apps or that the resource is trustworthy. The Canadian Red Cross is a well-known organization that is trustworthy. This app will provide tips on how to treat common emergencies. It'll also tell you when to go to the emergency room. Because as an emergency physician, we certainly see a lot of people that probably could have been easily managed at their family physician or a walk-in clinic. And it'll prevent us from overcrowding the emergency rooms. It'll prevent exposures to potentially other illnesses. And it also just is the best use of our healthcare system. You can call 911 directly from the app, and it'll also, one sec, there we go. And it'll provide safety tips for environmental emergencies as well. This, like many of the other apps, are available in a multitude of languages. And so you can check it out and see if it's available in your language. And I saw some notes in the chat. I've lost that, but Anne-Marie, if we do get to a point where we've got a bunch of questions and you want me to go through it, just let me know.
Thanks, Noah. I think we're good for now. It was just one question from Zarif around the sharing of the PowerPoint presentation, and just wanted to confirm that, yeah, we'll be able to share this presentation with you all later this week.
Okay, perfect. Yes, this will be available, and it'll be available also on our website. Be sure to check out the iCON website for this and other great resources, as well as educational tools. So next up, we're going to talk a little bit about nutrition. And this is something that I think can be a very useful app to get, because unfortunately, I find often that our education system doesn't teach us enough about what healthy nutrition is and what to look for. We know general things like vegetables are good for you, McDonald's is bad for you, but many people out there don't fully understand what the difference, say, macronutrients or micronutrients are, and how to track those, or if they should. And this is a great way to help you manage your weight, which is linked to things like diabetes, cardiovascular disease, hypertension. So using these apps can be really a useful way to keep an eye on what you're eating and what you're putting in your body. We're also going to talk a little bit about sleep apps. You've probably heard of some of them, but sleep is also another really important category to help improve overall health. It's not like taking a hypertension or a medication for hypertension. Getting sleep is going to improve overall health as far as cardiovascular disease again. Mental health is the big one. And just general sort of functioning in society. You'll be able to exercise better if you're getting good sleep. You'll be able to eat better if you're getting good sleep. So we'll talk a little bit about those. First up on the nutrition scene are these three apps. So many people have maybe heard of some of these. MyFitnessPal is a really excellent resource. It's one that I've personally used multiple times. It's made by Under Armour. There is a free version as well as a paid version. The free version is excellent and pretty much has everything that most people would ever need. It's essentially a large repository of nutritional information, and you can actually scan food items to determine how many calories are in it, how many grams of fat, how many grams of protein, how many grams of carbs, so the major macronutrients. So say you've got a box of cereal or some crackers, you can just scan the barcode and it will automatically pop up what all the nutritional content is. And then you can log that so that the next time you eat those crackers, you just add those to your intake for the day. So it can be a very useful app for that. MyNet Diary is very similar. And this is one of those exact situations where you just try both, see which one works better. MyFitnessPal can sometimes be a bit overwhelming, and MyNet Diary might be a better suited to what you want it to do. The Lose It app is focused primarily around weight loss specifically, and it provides not only nutritional information, but also nutritional plans. So if you want to lose a certain amount of weight, it can help you do that. It will also provide some suggestions for exercise. MyFitnessPal is less exercise focused. It will allow you to make goals, say, I want to lose 5 pounds over 6 months. And then if you actually track your calories, it will get you there. Either way, for people that aren't maybe trying to be that specific, it's a great way to get a general overview of your nutrition. Sleep apps. So Sleep Cycle, I think, is probably the most famous if you've ever looked into sleep apps. It's a really useful application that will track your sleep, and it will also give an output as far as the quality of your sleep. So the way that it tracks your sleep is obviously you just click start, and then it will track until you wake up and turn it off. What's useful about that is that it primarily just makes people aware of how much they're sleeping. A lot of people may think that they're getting 7 or 8 hours, which is what the recommendation is, but turns out on average they are getting 6 hours and 20 minutes, or on average they're sleeping 9.5 hours and they didn't know that. So this can be a great way to get a sense of where you're at. As far as the quality, what it will do is track your sleep based on movement, and it can do that through your phone's microphone. It'll hear when you move in the bed, or you can stick it right on your bed and it will track you when you move the bed. It also is able to determine if you sleep with a partner. It can somehow differentiate your movements from theirs. So really useful app for that. The other thing that is excellent about it is that you can track behaviors that may or may not predict your sleep quality. So let's say you like to have tea at night. You can track when you have tea at night and your quality of your sleep and how you feel in the morning. Perhaps that caffeinated tea at night reduces your sleep quality. Putting in that data allows you to determine if it's affecting things. The other sleep app, called Slumber, is a little bit better than Sleep Cycle in terms of helping you get to sleep. So as you can see on the scrolling thing there, there's a lot of different ways that people can experiment with sleep stories or meditations or sounds, that type of thing, to help them fall asleep. Because many people, when we study insomnia, have the one type where you have a hard time initiating sleep. Some people have the problem where they wake up and then can't get back to bed, but this can help you both get to bed and stay in bed, stay asleep, sorry. There we go. So next we'll talk about a few apps that can be used for exercise. So with exercise, unlike many of the other apps, people do need to be careful about what they are doing and to not do anything without first talking to your healthcare provider if you're not sure about whether or not you can do that program. I say this because some people have various musculoskeletal injuries or problems with, say, joints or their back, that type of thing. So if you're not sure, just check with your family doctor, run it by them, and they should be able to tell you. The other thing is people with cardiovascular conditions, such as previous MIs, hypertension, strokes, should consult their healthcare provider before starting anything new. But you're always welcome to check it out, see if it's something that you have done in the past, and if you think you can handle it, that's okay. But if you're unsure, check with your doctor. So this is one app that's really useful for older adults in particular. It's got a range of difficulties, but it's primarily based on being useful for people that are more beginners when it comes to exercise. The workouts are short, they're 7 minutes. You can select what your goal is, and sometimes you can select what your workout is, or you can just allow the app to select it for you. It's a great place to start, and you can continue to do multiple 7-minute workouts if you want a greater challenge. Some of the exercises you'll see over here are still challenging. So jumping jacks, depending on your joints and everything, that might be hard. Side to side hop, same thing. Or one-legged squat would be very difficult for most people. So you'll have to still select which ones make the most sense for you. The Nike Training Club app is probably the most famous, as far as I've seen, app for exercise. It's generally for people that are a little bit more advanced. It's created by Nike, of course, and also a lot of professional athletes, professional soccer players, professional football players, that type of thing. And it will often go based on time. So you want a 20-minute workout, it'll provide you the 20-minute workout. Or if you want to do yoga, you can pick a yoga exercise. If you want to do strength, you can do strength. One of the great things about this is that it offers both at home and gym-based workouts. So if you're just, because of COVID, of course, many of us don't have access to the gym the way we used to and are just exercising at home. So you can do that. Or if your gym is open in a safe way and you're going to the gym, you can use this at the gym with different equipment. Even if you have a set of dumbbells, you can select that within this app and just say, I've got dumbbells, and that's what it'll tell you to use. Neo U is just another option, another jacket that you can try on for size. So it's very similar to the Nike training app. It provides lots of different workout options. It does cost money, but you can try it for free for 7 days. The Nike app itself is free, but this one for some people may be a better fit. Fitocracy is an interesting concept. It will provide workouts, but it'll also provide a coach. Many people sign up for personal training, not so much because they need to have someone there to tell them what to do, but they find if they pay for someone to be there, they will show up. And showing up is more than half the battle when it comes to exercise. So for those people that feel like they just need someone to hold them accountable, this can be a great way to do that, and certainly a lot cheaper than getting a personal trainer. Charity Miles is a cool concept. So this app allows you to track your miles walking or kilometers, and then you select a charity that you want money to go to. And what people will do is they'll pledge money for every, say, kilometer or whatever that you walk. And so when you do that kilometer, you do 10 kilometers, that amount of money will go to the charity that you select. On reviewing the app, it does look like it has been having some issues as far as technical challenges with the most recent update. But I personally do have this app, and I'm planning to use it more, especially in the future once they kind of sort out some of the bugs. But I think this is a great way to motivate people not only to exercise, but just to get out, to give back to charity, to be aware of some of these social issues. And the charities are both local and international. And by local, I mean North American. It's not like you can select a Vancouver charity, as far as I know. This app is specific to yoga. It's called Daily Yoga, offers many different yoga classes and can be used at different levels. It's got quite a few languages that it's available in. And this can be really good for older adults who are trying to work on their mobility as well as their strength. And it's generally very safe, especially if you pick the beginner workouts. And of course, you can do this in your home, outside, in a field, wherever you want and wherever you feel good exercising. The last thing that we're going to touch on is mindfulness. And depending on your background and how much you know about mindfulness, you may or may not practice this, you may or may not have heard of this, but certainly there's mounting evidence that a regular mindfulness-based practice leads to a lot of health benefits. The same way eating well does, the same way sleeping does, and the same way exercise does. It's one of those global things that's going to improve a lot of different aspects of your health. So we're going to talk about 4 different apps, some of which you may have heard of, some of which you may not have, that are all related to mindfulness and mental health. Some of these are similar and some are very specific to certain conditions. We'll talk a little bit about each one. The first one is called MyLife Meditation. This is the one that I use right now, and I think it's excellent. So it's based on short meditations. I just use the free version. And you essentially log on to the app. You put in, say, how you're feeling now. Maybe you're happy, maybe you're feeling nervous, maybe you're feeling whatever. It lists a bunch of emotions, you put them in, and then it will suggest different meditations and different mindfulness-based practices to try out. And what I like about that is that you don't have to make a decision to which meditation you're going to do. You just let the app decide, and I like that. And they're also very short. You can do 1-minute ones, you can do 8-minute ones, but it doesn't take a lot of time. Insight Timer is another really good app. This has probably got the biggest number of meditations. And I think once you're past that initial stage of just trying to meditate a little bit, or once in a while, this app is a really great way to explore different practices. So you can do transcendental meditation, you can do breathing exercises, you can do really anything that you want. The way that it works is that it's like a crowdsourced uh, meditation repository. So if, let's say, I'm a meditation teacher, I can upload my meditation to this environment, this app, and then you can select that meditation to do. And if you happen to like my style, you can see the list of meditations that I've uploaded. Also within this app, you can get a course. So if you want to do a meditation for improving performance at work, there's a 10-day course on that. If you want to do a course on reducing anxiety or improving sleep, there's courses for these different things. Similar to other apps, there are free and paid versions. Primarily, the paid version, I think, just gets you access to the courses. I've used this app as well. It's really great. The downside of it is that it can be a little bit overwhelming because there's so many meditations, but a really good resource to check out. Mindshift is a great app that's a little bit more evidence-based and specific. So it was developed by Anxiety Canada and focuses on cognitive behavioral therapy. That's what CBT is, for anxiety relief. Anxiety is a huge issue at baseline, and with COVID and the social isolation that people are going through and anxiety over new variants and immunizations and all this stuff, this can be a really great tool for yourself and community members to explore. It's available in both English and French. I don't know if it's available in other languages other than that. I don't think so. PTSD Coach Canada is an app developed by Veterans Affairs for obvious reasons. A lot of veterans do have issues with PTSD. And I think what's great about this app is that it sort of amalgamates a lot of the evidence around PTSD, and there's a lot more that we know about it and a lot more treatments available. And this app is a great place to start for people that have had trauma in the past and want to explore a self-directed approach to managing it. Headspace, I think, is the most famous one of the mindfulness-based apps. It's a fairly simple app. It will provide you with sort of awareness meditation, so becoming aware of your breathing, focusing on your environment. It's a lot about focus and just basic mindfulness, but it's those basics that really help people manage their anxiety, practice gratitude, all of that stuff with mindfulness. And it's a very easy to use app. It used to be free, and now you're quite limited in terms of what you get for the free version of this app. So it does cost a bit of money. Depending on the person, it may be worth it. For those that are interested, there's also the Headspace Netflix series, which is a little bit about the founder, I believe, and also guides you through some of the meditations. But this app is really excellent, and it's a place that many people start. So we've covered a lot. We've covered a lot of different apps. I hope that people have jotted down a few that you thought that might be worth a download. One of the things I do want to talk about is how to assess an app. So similar to our other presentations where how do you assess an online resource, we have to look at a guideline for how do we determine if I want to keep the app, if I should use this app in the first place. So a couple of questions that you might want to consider asking yourself is, first, and this is what we talked about in the beginning, is does this app help me track my goal? If your goal is to reduce anxiety and the CBT app from Anxiety Canada isn't helping, maybe Headspace will. Try different things. If it's not working, try something else. There's no commitment here. How often did I use this app in the last week? That's a great way to assess whether or not you're going to keep using the app. So if you haven't used it in a couple weeks and there's a reason for that, it's probably time to get rid of it. If it's an app that is designed to be used once a month, then that's fine, but a good way to consider whether or not you should clean it off your phone. Is this app easy for me to use? So the meditation apps are a great example. Some are just much more intuitive than others. They all do the same thing or a similar idea, but some are just easier to navigate. That Meditate Insight Timer, the one that I told you that was really big, that's a little bit harder to navigate than something like MyLife, which is very simple and straightforward. So figuring out what works for you. Does it fit with your lifestyle? Is it conducive to what you're trying to achieve and how you want to do it? So does it suit you? how much information do I have to put in? We'll talk about this in a second, but that's a way to be a little bit aware of what your online presence is and to ensure that you're not giving away key personal information that you shouldn't have to for just an app. And then the last thing is, what features did I think the app was missing? For example, with Insight Timer, I gave that example of I've used that before. What I found was there were just too many decisions for me. I didn't like having to decide which meditation I wanted to try. I wanted the app to just tell me what to do because I wanted to do a bit of mindfulness meditation in the morning and my brain needs time to wake up. So you can just let the app decide what you're going to do. So this is just a quick word of caution, a few sort of red flags, if you will, for things to watch out for when downloading an app. So always be careful if an app asks for your personal health number. That essentially should never happen unless it's a BC government app. You may use the My eHealth and different things like that. That's a reasonable one to put in your personal health number for, but anything else, they shouldn't ask for that. Same with social insurance number. I can't imagine a situation in which an app would need that information, aside from maybe a government app, but even then, I think that'd be unlikely. If they need your address, that's also rare for an app, unless they're delivering something to you or anything like that, you shouldn't have to put in your address. You might wonder, well, if I need to pay for the app, don't they need my billing address? That generally goes into the central repository of either the Google Play Store or the App Store. So the app itself shouldn't ask you for your address. If it asks you for your passport or driver's license, be suspicious. If it asks for your date of birth, they shouldn't really need that data. And they will, that's one that they often do ask for, and you can just make it up. Maybe put in the same year, but a different birthday, just so that they don't get that information specifically. And then any financial information should raise a big red flag for you if they're asking for that.
Hi, Noah. Do we have time for a quick Q&A break?
Yeah, sure.
We've got a few questions building up in the chat. We have one question around any other app recommendations for mental health first aid or any other mental health apps that you would recommend.
Health apps or first aid?
Mental health first aid and mental health apps from Ankita.
Okay, so as far as mental health apps specifically, I think that the PTSD one and the CBT one that I mentioned are really good for specifically mental health. The other two are a little bit more general mindfulness, but they can be used for sort of evaluating your mental health or improving it. Because like MyLife, for example, if you put in that you're feeling sad or depressed, or like they'll have those options. They'll recommend certain types of mindfulness-based meditations to do. So that would be my suggestion. Again, if you need more intensive sort of discussion around your mental health, talking to your family physician would be a good place to start. But yeah, as far as apps, those are the ones I would recommend. And then what was the other one? First aid?
Mental health first aid, it says.
I'm not sure what that means. Sorry, if I close, maybe I can read it.
For sure, just the chat box.
Yeah, I think I stopped sharing my screen 1 second. Oh no, I'm still sharing it.
Yeah.
So apologies, I can't seem to see. So I'm gonna have to move on. I'm not sure what that.
No worries.
And first aid, I'm not sure. The first aid, I would just recommend the Red Cross. That's the one I've come across that seems to be from the most reliable resource.
Great. Yeah, perhaps we can follow up with you, Ankita, about that after. The next question is around measuring devices. Kelly asked, are all smartwatches very similar, or some are better than others? He's using a Fitbit, measures his sleep cycle, but not sure about its accuracy. Also, they have a premium app that requires monthly payments for advanced features.
So as far as the mechanics of which one is the most accurate, I don't know. I'm not an engineer. I think that all of this stuff, take it with a grain of salt. And the best thing is to see if what your device tells you correlates with how you feel. So if your device is telling you you got a terrible sleep and you feel fantastic, then that's probably not accurate. I've heard that like the Apple Watch is probably more accurate than the Fitbit, but I don't know if that's true. There's something also called the Aura Ring that is supposed to be very accurate for tracking sleep. But again, I'm not sure. I think the best thing to use as a gold standard is how you feel.
Okay, great. I think that also addresses follow-up with how accurate are sleep measuring apps. I think, again, it speaks to how you feel.
And I'll just speak a little bit because I've used the Sleep Cycle app, and I found it very useful for tracking my sleep when I went to bed and when I woke up, and what factors I thought might affect my sleep. So I would put in different things, like if I had a bit of chocolate and I was curious to see if that would affect my sleep, I would add that, and then I would journal like how I felt in the morning, and then I could go back and look at what nights I had chocolate and if it affected my sleep. Or if you have a glass of wine, does that affect your sleep? Yeah.
Great. The next question is around, is TELUS Health trustworthy? My friend recently used this app to see a doctor and got the treatment very quick, and this app needs your personal health number.
So you're talking about Babylon, I assume? So
yeah.
So I can't speak to Babylon. I don't work for them. I've seen a few patients that have been sent in from Babylon, and the care provided seemed appropriate. That's anecdotal. I think personally and professionally, I think we always have to be very cautious when there's bias at play. And so Babylon and TELUS are for-profit companies. And so you need to be, personally, I think you need to be careful when you're mixing money and healthcare. But I think it's worth, like any app, trying, seeing if you like the service and going from there. I think it's still best to check in with your family physician, but if you can't get in, give it a try.
Great.
I know quite a few people that have been happy with it as well.
Great. And the last question for now is, any recommendations on apps for counseling for seniors? And if there are any recommendations for podcasts for seniors in regards to some engagement activities? We know there are online programs, but if there's any app as well.
I don't know about any specific apps for counseling for seniors. There are different apps where you can check in with a counselor. I can't recall them off the top of my head, but I think stuff for very specific questions like this, I would try a Google search. Apologies, my doorbell is going off. I don't know who's there. This is the magic of Zoom. So yeah, I would try a Google search.
Great. Thanks. I think that's all the questions in the chat for now.
Okay, I'm gonna go back to the presentation. Okay, so we're gonna start with our first poll question. So this is just a bit of feedback for myself and the iCON team. So first off, yeah, if you can answer this in the box that pops up on your screen, that would be great. Okay, and then we're gonna go to one more. Thank you guys for answering these for us. It's very helpful. So as a result of my participation, I feel more confident in managing my health. Great. So close that. And then based on what you learned today, are you planning to download and use a health app? Great, this is awesome. I think one of the goals, as I mentioned, is just to get people to jot down a few that they may even consider trying, because generally most of these apps are not going to take away from your health. It's not. It's very unlikely that there's a risk involved unless you aren't paying attention to those red flags. Tracking your nutrition, doing a bit more exercise, tracking your steps is going to generally lead to improved health. So most of these are pretty low risk. I'm going to close that. Oh, I think this is the last one. I am now better able to find the services and or resources I need in the healthcare system. Great, thanks guys. So that's the end of the presentation, the overview of some really great apps within those categories that we talked about. Again, there's no way to review them all. The idea is to give you a few categories to consider and a few apps to consider as well, and then find the jacket that fits you best. So if there's any questions about this presentation or health apps, happy to field them. I may not be able to answer tons of specific ones about exact app purposes, but I'll try my best. I'm just going to open the chat because I think I can see them. So the explore. Okay, so Ankita was talking about the podcast app, exploring that. How do you download an app? So Verna, that's a great question, and maybe something that we should consider putting into this presentation for the next iteration. That's really good feedback. Thank you. So the way that you download an app, if you have an Apple iPhone, you go to an app called the App Store, and then you just type in the name of any of the apps that we talked about today. It'll come up. You click that. You click install or download, and then it will download. It may ask you for your Apple ID, and it'll download it. And Keita, I don't have the Lifeguard app, so I can't comment on that. Sorry. Generally, I mean, I used to be a lifeguard myself. So I think if the Lifeguard app came from the Canadian Red Cross or the Life Saving Society, then I would say it's probably a safe resource, like the presentation we gave on evaluating online health resources. Looking at the source is key. I don't know what the Lifeguard app was made by or what their biases might be, but that's the general principle is to look at what their biases would be and where the information comes from. Are there any other questions? Feel free to type in the chat. So Evelyn, yes, we've been talking about that, the iCON team. Anne-Marie, do you want to answer that question?
Yeah, thanks, Noah. We'll be sharing the PowerPoint presentation with all of the registered participants. We'll follow up probably later this week.
So Kelly asked, I'm a bit confused about measuring devices. Some apps are used on iPad. Does it mean that we don't necessarily connect it to an Apple Watch? An example is a sleep app. So you're right, Kelly, some apps only do download on the iPad, and does it mean that we don't necessarily connect it to an Apple Watch? So like I said, I'm not an Apple user, so I apologize, but most of the time Apple Watches connect to the phone. I don't know if they connect to the iPad as well. So I apologize, I'm not totally sure what you mean. Please list the names of the nutrition apps. So we'll send out the slides for all this, so you'll get those. But they were Lose It, LOSEIT. It was MyFitnessPal and MyNet Diary, I think. Can apps be also downloaded and installed on a PC? Zarif, I would imagine that I forget what the Microsoft Store is called, but I think you can download apps through a PC too. But you'd have to, it would be similar to Google Play. It depends on your computer. Yeah, Microsoft Store. Yeah, that makes sense. Thanks, Ankita. So it's a Microsoft Store. Pretty much most platforms are going to have some kind of app store or version of that. You're welcome, Rosemary. You're welcome, guys. Any other last questions? Otherwise, we'll close this off. Great. Feel free to email me any other questions or send them to the iCON team, and happy to answer any other questions that come up over email. Thank you guys for signing in and learning about this, and I look forward to working with you in the future as we roll out this information more broadly into the communities. Take care, guys. Bye.